protective gear is in high demand across the country as hospitals prepare for any potential Ebola cases. Eyewitness News reporter Rich Van Wyk explains how a Fisher's company is playing a big role in keeping those health workers safe. Rich?
But first, here at Indianapolis EMS, John, it is expecting 58 cases of new, more effective protective coveralls for EMS workers intended to keep them safer. At the same time, this Fisher's company is rushing to fill similar orders coming in from other healthcare providers across the U.S. and other countries.
This is the most popular product that we've been selling over the last several weeks.
In the few weeks since the Ebola crisis hit the U.S., sales of protective clothing for this Fisher's company have jumped 1,000%.
This one's a big one because I think it brings home to the public that our local infrastructure, although has come a long way, probably still has a little work to do.
DQE sells and manufactures a variety of infection control products. In one bag, there's just about everything a hospital worker, emergency worker would need to protect themselves. Kits of protective clothing for healthcare workers, bags to collect bodily fluids, portable decontamination showers, all sold across the U.S. and in several countries. Some of these may be bound for Liberia.
That's correct.
For soldiers there?
Potentially, yes.
Baumgartner believes healthcare providers are increasing their inventories, ensuring all precautions are followed, and expanding the number of workers who need protection. Indianapolis EMS is waiting for 58 cases of new moisture-proof protective coveralls. Unlike the current ones, the seams are sealed shut, preventing a patient's bodily fluids from seeping through.
We're going from a great suit to an even better suit.
The improved protective gear is 2.5 times more costly. Suppliers have warned the agency even bigger price hikes are coming.
As we understand it, prices are increasing, some as much as 400%, depending on the type of suit or who it's coming from.
DQE and Fisher says it has held prices steady, but it's expecting price increases from its suppliers at the beginning of the year. At the same time, they are limiting or actually eliminating sales of protective clothing and gear to people off the street, the general public. The president there tells me he wants to keep the supply line open to healthcare workers to make sure they get the clothing they need to stay safe. Reporting live, Rich Van Wyk, Channel 13 Eyewitness News.